Good evening. This is Broadcasting ADHD Europe. I'm Hans van der Velde. In daily life, I work as a coach. I coach employees for employers. And next to that, as a volunteer, I am the chair of the Dutch Science Committee of the Dutch Association for People with ADHD and Dyslexia. And next to that, I'm vice president of ADHD Europe. Tonight, we're going to be introduced in a tool for GPs, as well as psychologists or coaches, etc., where they can learn about ADHD. And before we go to Blandine, who is the star of the night, Billie, can you introduce yourself, please?
Hi, I'm Billie Wilding. I'm a board member of ADHD Europe, and I'm in charge of the technology for tonight's webinar. So if something goes wrong, you know who to blame. I'll be reviewing your comments, making sure we get our PowerPoint slides forwarded nicely. So if you have any questions for Blandine or for Hans, just stick them in the comments and on Facebook or on YouTube. And do be aware, if we do choose to bring your comment up, it will come up a bit like this. So you'll see it below on the bottom of the screen with your name and your profile picture. So feel free to make a comment. And if you don't want it to be shown, just let us know. Hans, over to you.
Yeah, thank you for the explanation. Blandine French, who has a PhD, made a fantastic tool for GPs. Blandine, can you please introduce yourself?
Yeah, that's fine. Actually, that was part of the presentation. Shall we get started with the presentation? Will that be an idea?
Yeah, wonderful. Yeah, you already implemented it in the presentation. So if you can start sharing.
That's fine, video, if that's okay with you.
Because you didn't just start, let me make a tool. It comes from your internal motivation. And that's what I like about your approach. So that's really fantastic.
Yes, absolutely. I'll tell you all a bit more now. So if we can move to the next slide, please, William. I'll just tell you a little bit more about myself and why I'm presenting today and where this comes from. So I'm Blandine. I'm a researcher at the University of Nottingham. And basically, a bit of background is I was diagnosed with ADHD as an adult. And for me, receiving a diagnosis was the best thing that ever happened to me. Because at the time I was a restaurant manager, I was a bit of in a dead-end job, and I didn't really know what I wanted to do. And I had to get out of this job. But I always thought that I couldn't study, I couldn't go to university, I was rubbish at school, or at least studying just wasn't for me. And when I found out that I had ADHD, it just opened so many doors. It made me realize that it's not that I couldn't study, it's just that I had to think of a different way of studying. I just couldn't study the same way that everybody else did. But if I put accommodation in place, and if I found the right support and the right strategies, actually going to university could be a possibility. So I put things in place, and I learned a lot about ADHD and what it meant in terms of my learning. And I went back to university and did an undergrad degree in childhood psychology. And then this led me to doing a PhD at the University of Nottingham that I only finished this year. And ADHD runs in my family. My niece has it. You know, my husband has it. My 3-year-old boy has it. You know, like I think this is something we live with on a daily basis. But also, my PhD was on ADHD, was on understanding the pathways to care for ADHD. And right now I'm working on a project with how to set up an app. We're just trying to look into an app to support people who are waiting for a diagnosis. But also on the side, I facilitate peer support groups for parents of children with neurodiversities and adults with ADHD. So just to explain that ADHD is part of my daily life all the time, whether it's at work, whether it's in the volunteer work that I do with the support groups, or whether it's in my family. This is something that I live with constantly. And what I'm really surprised with ADHD, and I felt the need to talk about it today, was that, you know, no matter how much you know or how much you live with it, you're always learning something new. There's so many different layers and facets of ADHD that keep surprising me, because I keep thinking, oh, you know what, I think I'm a bit of an expert, by experience, and this is what I do for a job, and this is what, I see people with ADHD all the time with the groups that I run. And actually, I always find something new, even now, 10 years after my diagnosis, where I'm thinking, oh gosh, this is ADHD as well. So, for example, when I was pregnant, there is a phenomenon called baby brain. When, pregnant women or women who just gave birth, their brain is a bit foggy. And this baby brain with ADHD was really difficult to handle, because when you're pregnant, you can't take your medication as well, or when you're breastfeeding, you can't take medication. And this is something I wasn't prepared for. And this is something that therapists and healthcare professionals didn't warn me about, the effect of pregnancy, of the hormones on my ADHD, the link between the two. And recently, it was more about, unfortunately, my father passed away a couple of months ago. And I find that grief really exacerbates my ADHD symptoms. And again, this is something that I wasn't prepared for. The mixture of grief versus ADHD is something that just makes, my ADHD worse. And I didn't know about that. And again, this is something that no professional had warned me about. And, I didn't read in any books, the warning of all these big life changes, especially as a woman, when you have lots of hormonal changes through menopause and through giving birth and through being pregnant, how much it affects this condition. And I mean, this is not what this presentation is about, but I just wanted to explain that for me, I think you're always learning about ADHD. There's always something new. There's always different layers. And I wish there would be a time, in the near future where we will have a really comprehensive understanding of this condition, where this will just be, known.
Yeah, I think that's a wonderful startup you made here, because in fact, that is the ADHD community and the specialists, we do already know a lot about it. Not everything, but we do know a lot. But how do we get it to the GP, to the psychologist, and especially to the people who are having their diagnosis, and what can they expect now that they know they have a diagnosis? And what does it mean for your hormones, for your emotional regulation, etc.? So that's a wonderful motivation to start about the tool you want to talk about. So thank you for bringing this up.
Yes, thank you, Hans. And this is lead nicely to what I'm going to talk about. I mean, for me, getting a diagnosis changed my life. It allowed me to go to university. It allowed me to get a career that I love. It was just a positive thing. And I started thinking, well, why wasn't I diagnosed for so many years? Why did it take 30 years to pick up ADHD? I grew up in France. Nobody knew about ADHD when I was growing up. And then in England, for 15 years before I moved away, then why wasn't it picked up? And I started thinking of the process of diagnosis. And this is why I thought I would focus on the GPs, because at least in the English care system, the GPs are at the source of, without a GP referral, you can't get any further help. So I did think, well, why did the GP never pick that up in me? So I will move on to the project in a minute, but I just wanted to say one last thing. This is what drives me, because my experience was positive, because I got a lot of the diagnosis. This is my drive. I am passionate about helping people, and I just want to help people access care as early as possible, put strategies in their life as early as possible, so they don't have to struggle for as many years as I have. So some of the risk factors associated with undiagnosed and untreated ADHD are lessened, and you can channel the positive of ADHD and make the most of having this condition. Now, I just want to say a little caveat here that I'm not saying that ADHD has only positive, because it doesn't. It's hard, it's difficult to live with, and there's nothing negative. But I strongly believe that the earlier you can put strategies in place to live with that and to make the most of it, then the better it is. Anyway, Vilio, if we can move to the next slide, please. So the ADHD pathway to care in the UK, at least, I understand that it might be slightly different in different countries, but in the UK, basically GPs don't diagnose or treat ADHD per se. The GPs will, send a referral through to secondary care services or specialist services where diagnosis and treatment takes place. So GPs don't need to know a lot about ADHD, but they need to know enough to be able to identify it in their patients. And sometimes they will take over the medication subscription, but they don't initiate it. So they have a small but very important role in gatekeeping, in assuring that the patients are being sent to the right services. So if we can move to the next slide, please. So what I did as part of my PhD, if we can have the first and the second, no, that's fine, thank you. I looked into all the literature that was published on the subject. I did a literature review, and I interviewed GPs to try to identify the gaps in their knowledge of ADHD. So the first gap was that the lack of knowledge and training. So we found out that in the UK and in many countries, actually, ADHD is not part of the compulsory training for GPs. So GPs can go their entire training and get to work without never having known anything about ADHD. And what that means is that the knowledge that they do have, they pick up from patients, they pick up from the media, they pick up from their colleagues, and basically they pick up from resources that are not necessarily reliable. So their knowledge is not is not straightforward. If we can move to the next one, video, please. Then there is a lack of identification. So again, what I found is that a lot of patients had to initiate the diagnosis process. So the patients, the families, the parents will be struggling a lot, start looking it up online, and then go to the GP and say, I think my child has ADHD, can you please send a referral through? To all the GPs that I interviewed and all the patients that I interviewed and all the secondary care staff that I interviewed, as well as the literature review, none of the GPs identified it themselves, which is quite problematic because it needs to come from the patient. But if the patient doesn't know that they have ADHD, like myself, I didn't have any behavioral problem. I was doing well at school. I wasn't really hyperactive to the point that my parents would need to seek help for that. Then it wasn't initiated by me or my parents, therefore I didn't get a diagnosis. The next one, please. And what we found as well is that there is a difficulties in communication between all the different professionals. So you need to get school reports, you need to talk to specialist services, and they need to send reports back and forth. And that made the diagnosis problem quite complicated. And the next one, please. And also one of the last gaps that we identified was the lack of resources and services. And again, this might be, I'm sure it's experienced all across Europe, but this might be quite UK specific in the sense that a lot of services are not commissioned for ADHD. So the GPs will say to me, well, where do I send them to? There's no specialist services. So I'm happy to give them, I think they do need a diagnosis, but we don't have the right, we don't have the time or the money or the right places available in where we live. So these are the gaps that were identified. If we can move to the next one, please, Billie. And what does it mean in practice? So in practice, it means that if the patient doesn't initiate the referral, then they are very likely to not be able to get a diagnosis because no one is picking it up, no one is identifying it. Patients might be missed and referred to the wrong services. So in the UK, you have an ADHD and an autism service. So if you don't really understand the difference between ADHD and autism, for example, you might send a patient for an autism pathway, which would make them waste months in waiting and getting the wrong diagnosis, being on a service that is not for them. A patient might be giving up because there's such a wait in going through this entire process. and they might not have the strength to fight, to keep demanding for referral or waiting for all the different professionals to talk to each other. And it means that usually months, if not years, of struggle for patients before they can get a diagnosis and access to care. And throughout those years, there's a deterioration of mental well-being, which can have really long-lasting consequences on children and families. So it's really important that we pick up ADHD as early as possible. Next, please, William. And I just added these quick slides from a brilliant comic, a brilliant artist called ADHD Alien, who described very well one of the impact of untreated and undiagnosed ADHD. And this is something I can relate to personally. For years, I was treated for depression. I kept going to my GP, something wasn't quite right, and I was prescribed antidepressants and CBT and things like that. But actually, it wasn't it was depression, but the depression was a consequence of my untreated ADHD, which is summarized in this slide. And for me, that shows, the risks of not identifying, not picking up, not treating as early as possible, and not recognizing ADHD. Next, please. So what did we do? What can we do? So I decided to do an online training for GPs and try to address those gaps. What can we address? So the lack of knowledge and training is something we can address. We can try to increase their knowledge. We can give them the training, try to reduce those misconceptions about ADHD. And hopefully this will lead to an increase in identification. So we made sure the knowledge that we included in this training will lead to more identification of ADHD. And I mean, the difficulty communicating between a different professional is quite hard to address, but we did try to make sure we identify the roles of all different people within the ADHD pathway, the teachers, the GPs, the specialists, the parents, what are their roles and why, how can they talk to each other? This is something we try to address. However, the lack of resources and services was not something I could address in an online training program because that's something that's not in our control, unfortunately. So if we move to the next slide, please, Vilio. Vilio, we're missing the slide with the website.
The wrong one has moved. That's what's happened here. Let me fix this.
That's fine. If you can just go on the website, please.
Sure.
So what we did is we developed a training program for GPs with GPs. So we had a team of GPs that helped me develop this program because we wanted to make sure whatever we created was something that GPs would be happy to interact with, would be something that GPs will be willing to spend time on. So we created a lot, they generated loads of ideas, and this is the final product. So as you can see at the bottom, if we can go to the bottom of the website, there are two modules, and there's one module on understanding ADHD and the second one in the role of the GP per se. And the reason we separated those training is because, the first one is something that can be accessed by anyone. Anyone who wants to know more about ADHD can access this first module. And the second one is a bit more specific to the healthcare pathway in the UK. And while it's focused on the GPs and what do the GPs need to do in the UK, it's also relevant to people like teachers or secondary care workers or other healthcare professionals because it explains the role of each different individual throughout the care pathway. So I just wanted to quickly show you those two. So if we can go on to the first module, please, Vilio. So this is an example of one of the slides. So the training included videos and interactive tools, and everything we put on is evidence-based. We wanted to show GPs facts, hard facts that we know about ADHD after years and years and years of research. So the neuroscience part of it, the hereditary part of it, all the different. So it was hard facts that they could not argue with, to try and dispel that myth that ADHD is just a behavioral disorders and he's just the naughty boy, or it doesn't exist. So that's part, and there's also testimonies of patients that talk about how ADHD affect their lives. And in a second module for the GP, if you can go to the third tab, please, video. The GPs wanted testimonies from experts. So we got 4 experts. Dr. Gillott and Nurse Kekari are working in specialist services, Dr. Gillott for adults and Nurse Kekari for children. So they explained the specialist services here in the UK for these 2 different patients. Professor Daly is a renowned ADHD researcher that spent his entire career working on ADHD, and he explained from a research point of view, what does, how medication help, how we can support parents, what we have shown that can help patients. And finally, Dr. Smith is a GP that was diagnosed with ADHD in adulthood, and she allowed for, it's really good to have her testimonies because in herself she breaks a lot of the stigmas. She's female, she was diagnosed as an adult, she is highly educated and was very successful. So all these misconceptions about the fact that it's only in boys, it's only in children, it's all naughty kids, she kind of broke these stigmas by being herself. But also she was able to relate ADHD in ways that GPs could understand. So she talked about how her ADHD affected her within her practice. And this is something the GPs really responded well to. So if we could go back to the presentation, please, Billie. So to see whether this intervention did help patients, or did help GPs increase their knowledge, we did what is called a randomized control trial. So in a randomized control trial, we have 2 groups of GPs, one group that will look at the intervention and the other group that never sees it. And we want to see the difference in ADHD knowledge, in their attitude, in their confidence before and after taking part in that training. And what we found was that, basically the training worked very well. So Billie, if we can go through the 3. So we found that the training did decrease the misconceptions really significantly. Next one. It increased their knowledge and their confidence in treating ADHD and dealing with ADHD in their practice. Next. And finally, it improved their practice and changed their attitude. So it did basically everything we set out for, which was to just change the way that GPs understand ADHD. If we can move to the next slide, please. And this was what we were aiming for. I mean, it's all well and good to increase their knowledge and to increase people's knowledge of a disorder. But what really we wanted to do was to increase their attitude, to change the way they looked at ADHD, to change the those stigmas and those assumptions that are being made when people deal with ADHD, or healthcare professionals deal with ADHD sometimes. And it was really nice to see. We conducted interviews, and later on, where we found that the knowledge was retained over time, and the findings that we found that I showed you on the previous slides were retained over time as well. And these are some quotes that were given to me by some of the GPs about the impact of the training on their practice and on their attitude and on themselves within their practice, but also sometimes within their families. One of the GPs said, "Oh, I've realized that as I was going through the tool that, you were describing my nephew. So I talked to my sister and now she's just gone and get him a referral," which, was really nice to see. Next, please. So finally, a bit more about on the impact. I mean, this is just a slide to reinforce that, this training doesn't cost anything. It only lasts 40 minutes. and it's been used by many professionals since. It's been endorsed by the Royal College of GP in the UK, which is the leading GP training organization here in the UK. And it's just a short and cost-effective way of increasing healthcare professionals' knowledge and of ADHD. Next. So the final note is on, what's next. So the success of this intervention made me think that, there's loads of things that we want to do. What we're definitely going to do is that, we are planning interactive workshops that are coming up in next couple of months, I think, with ADHD Belgium and ADHD Europe. I think for those interested, you'll be receiving a link to sign on to waitlist. And these workshops will include very similar information that is on the website. However, it'll be more interactive, where participants can learn from other participants. We can reflect back from peer to peer, and opportunity to interact with different people and their experiences of dealing with ADHD on a day-to-day basis. So it's a bit more in depth and more interactive than the website. And I'll be offering those soon if anyone wants to attend. And then finally, I am putting funding calls to get. I'm waiting to hear whether I received enough money to translate it into French and Spanish. And in doing so, we will also adapt it to European care pathways. So it's not just enough to translate it. We just also want to make sure it matches the way that ADHD pathways work in different countries. We will also like to develop similar programs for parents and teachers. So how we have understanding ADHD and then the role of the GP. I would like to develop, the role of the parent and the role of the teacher, and how each different professionals or each different bodies can understand more about how they can help children and adults better. And finally, we're also putting a grant application to understand the costs of undiagnosed ADHD. So as I mentioned earlier, through this project, I found out that ADHD wasn't part of the compulsory training for GPs. And what I would really like to do is make it part compulsory. I think GPs should be trained automatically about that, and all healthcare professionals for that matter. And in order for that to happen and to make a case and to make an argument why this should be done, we need to make a financial argument. We need to show that not treating ADHD costs more than treating ADHD. There's some cost involved in the treatment of ADHD and the care for the diagnosis. But as we know, not treating it leads to more depression, more divorce, more imprisonment, more risks of substance abuse. And all these carry a cost as well that, in my argument, are higher than medication, for instance. So I'm trying to get funding to do a health economic costs evaluation for this to strengthen this argument and hopefully push the agenda of making ADHD training compulsory. I think that's the last slide after that. Video. I think we have one more slide. Oh, that's it. Thank you. I think I've covered everything, but sorry, I'm on my phone as my computer is not working, so it's quite hard to navigate everything and to see what.
No problem.
Yeah, I think that's it for me.
Okay, well, we're not finished yet because this is a wonderful tool. So thank you for your very clear presentation so far. But first, there are some questions about, let's say, what's all around it, and then one or more questions to really go into the content. Mm-hmm. I am challenging the GPs that are in the room now. I know one from Edinburgh, Suresh, and one from Rotterdam, Eva. So if you have a question, please put it in the comments because you are the real experienced GPs here. But a question was, let me roll back in the comments. When you say GPs in the UK, does that include Scotland, as our NHS is devolved in the Scottish Parliament? So what is your opinion about it? Is it in general applicable for all GPs all over Europe, let's say, or?
I think to a degree, yes. I think there might be some slight variations between different countries and maybe different between, Wales, England, Ireland, and Scotland. But I don't think the differences are substantial. I think that the pathway, the diagnosis pathway for ADHD is very similar across Europe.
Yeah.
And to be fair, it varies even across England. In some places you can self-refer. It's quite rare, but it does happen. You can, you don't have to go through your GP, but that's not everywhere. And so I think in general, yes, it's very similar in Scotland. However, there might be some slight differences, but their knowledge still needs to be very similar anyways. I don't think there's any difference in how much they need to know or what they need to know to care for their patients.
Yeah, sure. I can confirm that. Of course, as preparation of this webinar, I've been looking into the website, and I saw, from my knowledge, at least for the Netherlands, but I've been around in Europe also, it's very applicable for all GPs all over Europe, because it's not specific about what is this ADHD service around the corner. It's how do you go through the care pathway and which knowledge is really necessary for a GP. And which brings me to another question. Is this also, in your opinion, Blandine, applicable for a psychologist, a coach, a parent? And in how far, totally or partly only, or what would you say?
Definitely the first module is applicable for anyone. Anyone that wants to get a better understanding of ADHD will benefit from looking at the first module of this training. And the second module, although it does focus on GP, is very helpful in order to understand. I mean, there's loads, for example, Professor Daly talks about evidence-based with regard to medication and treatment. That's applicable for anyone who wants to know more about medication or parent training, for example. The specialist services, again, apply to anyone. Anyone would benefit from understanding what happens after a referral. What do they do in the secondary care, in where they do the diagnosis? How does the diagnosis work? So yeah, I do think there might be some information that's not as relevant, but I do think we made it broad enough that it will be for a lot of different professions, even teachers and parents, just so they understand the different roles of all the different stakeholders.
Yeah. Well, thank you.
Just to add, Hans, I've done the course and I found it very useful myself. But the one thing to point out about levels of knowledge is that it's not just a postcode lottery in the UK. It's not just that your GP's knowledge might vary. Different GPs in the same surgery can have very varied knowledge in ADHD, and it really can be luck of the draw who you see as to the knowledge they have at the moment. I know from personal experience that my sister's diagnosis ahead of the practice has very little understanding of ADHD. But seeing another GP, she said, well, I don't really know much about this, but I know enough to know that the signs are clearly here and that you've scored highly enough on the form that I should make this referral. And even though the common understanding of how ADHD presents in girls is much farther behind, it's important that, this referral is made. And she really got it. But this is, something that all of our GPs should be expected to know, not just one person in a practice.
Yeah, sure. And I think just to add to that video is that, from the GPs, so when we did the randomized control trial, we looked at GPs' experience of ADHD, and even the GPs that thought that they knew a lot learned something from this training. I mean, it is quite basic, it doesn't go into depth about all the different nuances of ADHD, but there's still something that I didn't know in terms of, how the medication works, for instance, or how, just all the different, their role, exactly what they need to do, what they're supposed to do, what they're supposed to know, where to refer to. I mean, yeah, in terms of knowledge about ADHD or knowledge about the pathway, we haven't had one GP who turned around and said, I didn't learn anything.
Yeah.
So that's good.
There was already a question about in how far your training tool will be offered to mental health services, to the GP organizations, etc. What's your opinion about that? How do you think this tool will develop, but develop in the sense of spreading all over Europe? These promotions help, of course, this exposure.
Yeah. I mean, this is the tricky part. I mean, we developed it in a way that it's freely accessible online. You know, like we don't want anyone to have to pay to get this training. It's there. It's created. It's been shown that it works. So, in my opinion, I want as many people to use it as possible. But getting it out there is really difficult. You know, there's no one channel, one system where I say, oh, you know, if we put it there, then everybody will know about it. It's lots of word of mouth, and I'm finding it very tricky to get it known, basically. So in theory, it'd be fantastic if lots of people could access it all over the Europe, especially when we have the translation version, the translated version. But in practice, it's just really hard to implement, and I haven't yet found. You know, I've done loads of dissemination events and presentation. I've talked with it. Yeah, there isn't. I mean, it's been adopted by the Royal College of GP, which is in England, at least in the UK, the main body. Yeah. But even then, it's quite hard to get it out there. So
yeah, great.
I don't know what the answer is in terms of practice.
Yeah, sure. Viljo, can you bring up the question from Suresh Sanders from Edinburgh? And the question is, the biggest problem for GPs is the 10 minutes appointment. You'd be lucky to have 10 minutes sometimes. They do not have the time to assess a patient and will rely on the patient or family reporting problems. Do you have such kind of questions before during your interaction with GPs in your research?
Yes, absolutely. So when we developed the tool with the GPs, I mean, this has come up time and time again, and it's a really valid point, which is why the information we try to include, especially on the GP module, is how to spot it as best as possible. So the GP with ADHD, Dr. Corey Smith, does talk about, you know, the kind of things that you might see, you know, if an adult keeps coming up with depression, if a parent complains because their child is getting detention or getting excluded, or if they're we're just trying to give things to think about that might make the identification possible within 10 minutes. But this is really, really difficult, you know, especially if you don't see the same patients all the time. You know, a patient just coming into the practice that you've never seen before, that's complaining that he's a bit down, you know, how do you know? It's a very difficult concept, but it's also why it's really important to have a relationship with your GP and to, you know, to be seeing the same patients over and over again. Because as Billie was mentioning, you know, if you keep seeing different people in a practice and their understanding is very different, then it's more likely to be missed. So there is no easy answer to this question, and it is a problem. And I wish I was able to address it in this intervention and said, oh, you only have 10 minutes. Well, I've got the perfect thing for you. And in those 10 minutes, you need to do all these things. And if you do them, you're going to pick up ADHD every time. I wish it was that simple. Unfortunately, it's not.
I kind of disagree with you, because I think the answer in the end is simple. That's my experience. We've been doing workshops for company doctors as well as GPs in the Netherlands. And when they really have taken the time to be informed, they can recognize it. Of course, not the first 10 minutes that you meet someone, but if it's your patient In my case, it's a lot of company doctors, same kind. First step in the care path, and the company doctor sees them. If they are well informed about autism, ADHD, etc., they sort of instinctively, based on their general medical knowledge, their clinical view, they do refer to the right place. And in that case, sometimes we get the referral or other specialists, and they know, and they don't have to choose between ADHD and autism if it goes to a general healthcare clinic, which does the differential diagnosis, you see. So in fact, the answer is what you are presenting here. Go into this tool and collect general knowledge. I think that's what you are saying. Am I right here? So,
yeah, I mean, it's the first step. It's the more you know, the more you'll be able to identify it, the quicker you will be. Like it is. It's just not a straightforward answer. In a sense that I don't want to claim that if you take part in this training, then you'll be able to identify ADHD in 10 minutes appointment, which is the question. No. So it's just, but it is the first step, and you're completely right. The more you know, the better you understand it, then the easier it is to pick up in those short appointments.
Yeah, sure. Absolutely. Yeah, well, we've been doing some questions about the tool. I would propose to go into your tool again, because I was running through it and I found, you mentioned it yourself, see the difference between autism and ADHD, and you have a part in the tool. So if Viljo can start the page again and go to the GP training, and
Absolutely.
Then in the menu you will find ASD, ADHD, and I love the way you do it there. Is that right? Are you okay to look at it for a moment?
Yeah, sure. I think it's in the first training there, in that one. If you go to home, to menu, yeah.
Oh, in the first, not in the GP.
I think so, but to be fair, I can't really remember. Let's have a look in the menu video, please.
Right, I can hear you again. Sorry, my headphones just had the habit of dying there. Right. What would you like me to open?
Is it ADHD? Yeah.
Yeah, there it is.
That's the one.
Oh, that's nice. So just explain, please.
Can I have a go at this?
Yeah, sure. So it's a drop-in kind of game where there are some typical behaviors, shown for ADHD and ASD, and the GPs have to put it in the right, column, whether they think this is more of an ADHD or an ASD behavior, and see whether they can tell. Because this is something that came up a lot from the GPs. What is the difference? How can I tell the difference between the two conditions in my practice? And we couldn't go in depth into it, but we just gave them some clues, started to get them to think about those differences and what they will see. If a person with ADHD is more likely to present like that, so a person with ADHD is more likely to show that in your practice. So this was the game that we tried to show. You're more than welcome to do it, Viljo. I can't really stick them on my phone.
See, I have both ADHD and autism. I'm sitting here going, oh, interesting. And Hans, do you want to have a first go at moving, or tell me where to move something?
No. Then I can't read them in my screen.
Okay,
so
that's fine. I'm going to put that.
You have to read them out. Read them out, Viljo. What did you place where?
Does not like it if I've put can have difficulties with coordination into the ASD specific motor symptoms, because I think that's one of the things that's in my ASD diagnosis. I was doing the same thing. Now, I would say that this could probably be both, but we're going to put it nonetheless into.
I can't remember whether some of them can be both. It's been a long time. I think it's been 3 years since we set this up, and obviously I haven't been on it to do it. And I've got a feeling that some of them might be both, but I can't remember. Sorry.
No, it's quite okay.
I think that's why it's important to have.
It's just a very nice example of tools that are in to kind of learn more and to test your knowledge about it. And you're quite well informed. I can tell you I did it, and I made 2 mistakes that I didn't really read well. That's my thing with my dyslexia. Anyways, it's a demonstration. Why I especially stretch out this one, because you mentioned it, of course, but it is a kind of an issue in the world at the moment. The connection and the difference between ADHD and autism. I think there's a whole, well, I call it a hype to go too soon to autism, while in fact it's only the ADHD, which on a functional level can have some social problems in interaction. So that's why I point out this as one of the chapters in the whole tool. And I especially liked it because I bumped into it. So thank you for that. Let me see if there are any new questions.
No, I think I've got most of those, but I'm welcome to be told that people think I'm wrong.
I can't see what you answered, so I can't tell you either way.
That's fair enough. Let me just make that full screen so it's a little bit easier to see.
By the way, Blandine, you said it takes you about 40 minutes. I didn't succeed in 40 minutes. Sorry. If you really do both modules and really seriously read everything, yeah, I read very slow, I know, but it can take you more time. If you are committed and seriously going into it, it will take a bit more time, I think. But I hope you don't object me mentioning this, Blandine.
No, that's fine. That's fine. We did find that the average person went through it in about 40 minutes, but obviously, if you do want to really make it sink in and do it properly, yes, it will take longer.
Yeah. Okay, and that's clear. And did you get any report back from the GPs that you really tested?
Did I get what, sorry?
Did you get any report back from the GPs that you used in your test battery? Let's call it that.
We interviewed GPs afterwards.
And
do you mean in terms of the impact?
Yeah. So the issue for a GP is, can I recognize it quickly? Like you said, it's not like a physical thing that you fill in the list in 5 minutes, do some exclusions, do the B12 and the vitamin D and the whatever, and you test the blood, and then they come back, and then we know, okay, refer them to the internal or the cardio or whatever. So ADHD goes in another way. So did you get reports back from them?
Yeah, we did. When we did, so we interviewed some GPs that were happy to be interviewed 6 months after taking part, and we did start seeing the difference in their practice, the difference in the identification of ADHD, how it impacted. So some of them were able to pick it up quicker. Some of them were just able to refer back to screening tools. So it did have an impact on how quickly and how well they identified ADHD, clearer understanding of the pathways, of the services available. So yeah, we did have some feedback from that, and it was really positive.
And could you kind of prove that they were more easy to recognize the patients with ADHD?
No, this is something we weren't able to do. So ideally, what I would have loved to do is to say, all the GPs before that, they never identified ADHD, and after taking part in our program, they identified 10 people this year, but trying to put a number on that is really difficult.
Yeah, of course.
I mean, maybe if I was to interview them now, 2 or 3 years later, I can't remember how long it's been now, 2 years, I think, maybe, but it takes some time to see any changes in practice. So no, I wasn't able to quantify any changes, unfortunately, but I would love to do that and to see the impact it has in terms of referral and diagnosis, the concrete impact of that.
Yeah. So, well, here is also a job for ADHD Europe, because we have the overview over Europe, and in other countries also tools, etc., are growing. And I know about an app in the Netherlands that is quite well performing now. So we are looking into that, and then we can make the connections for people from different countries to work together. Like a country like Poland, here's a question from Anla Diowicz. Sorry, that's too difficult for me. For Anla, for example, in Poland, we can go to the psychiatrist directly. Unfortunately, most of them don't believe in ADHD or think it's a children's problem. I see potential to adapt this to educate psychiatrists. Well, it's a remark, but what do you think about that?
I think this links back to what we were talking about earlier on, which is, you will gain some information out of taking part of that. Yes, in theory, it's specific to GPs, but any healthcare professional that deals with ADHD will benefit from this intervention. And yeah, there might be some adaptation needed to make it more specific, but overall, the information included in this program is comprehensive enough to be valuable to many healthcare professionals across Europe. So, and especially in breaking the stigmas in, it only happens in kids, it's only boys. You grow out of it. Medication. I mean, I've had GPs telling me that they think medication is addictive. And that's coming from a medical professional. And I know from a fact from working with parents and adults that this happens not only with GPs, with psychiatrists, well, not so much psychiatry, but secondary care. There's loads of misunderstanding about ADHD. So anyone working with patients will benefit from that. Yes, I think.
Yeah. Okay. I think we can round up here. And if we don't have any other questions coming in, I'm looking at the comments now, then anything you want to add, Blandine or Viljo? Any questions?
No, thank you. Thank you very much for the opportunity. And if anyone wants to contact me or has any questions or wants any help or, anything, as I said, my passion is to make sure, especially little girls don't go through what I had to go through, get diagnosed as early as possible, receive care as early as possible. If I can help anyone, then please contact me and do that. I do that from my own experiences, from my own drive, rather than, so yeah, don't hesitate to contact me if you need anything, or if you want to know more, or if you want any help with anything, because if I can help another patient thrive from having ADHD, then brilliant.
Yeah. So thank you very much, Blandine, for this wonderful presentation. We are very happy to be able to present this, to give exposure to this tool. And we do hope it will be the start of a development in the whole of Europe, that we go more into supporting the GPs, the psychiatrists, etc., instead of attacking them and complaining about them, etc. No, help them, give them the tools, and then I think we all will develop in the right direction. If there are any questions, you will know how to reach us. Of course, I think Blandine, on your website there will be a contact button, I hope, to an email address. Otherwise, Viljo can give our email address.
Let me see. Well, people tend to have our email address anyway, but I can edit this lovely little banner. It's Blandine's website and Blandine's email address. Is that?
Thank you, Viljo.
That's completely fine. There we go. So at the bottom of the screen now is Blandine's email address and the website to get to the training. So you can see that online. And obviously that will be here for everyone who tends to view this afterwards on YouTube and on Facebook. Hello to our future viewers.
Yeah. So this was the closing webinar of ADHD Awareness Month of Broadcasting ADHD Europe. We hope to welcome you all, and we will be stalking you with emails for our new webinars in the coming month. And
so make sure you've signed up to our newsletter.
Yeah, you've given permission to be stalked by us. And thank you, Blandine, for this wonderful presentation.
Thank you, Hans.
Absolutely brilliant. Yeah. Okay.
Thank you.
Ciao.
Bye.
Bye-bye.
Bye bye.